Hi, I'm MacNeil, and I want to tell you about my new course that I'm developing with 3Spirit training. The course is called Care Act Eligibility, and it's aimed at the managers of provided care and support services. I'll tell you more about that course in a minute, but first just a little bit about me. I've been working in adult health and social care for over 25 years. I started out working in provider services myself. I was a manager of registered care homes for people with a learning disability, and then I went on to manage community-based supported living projects. About 15 years ago, I started delivering training and then consultancy, and have been working with as an independent trainer and consultant ever since. For the last 4 or 5 years, my work has almost entirely been supporting the statutory sector with the implementation of the Care Act. My main area of expertise in the Care Act is around assessment, eligibility and planning, and how those decisions should be made. I've spent hours working with thousands of social workers, Care Act assessors and their managers to ensure that the way they make decisions is guided by the practice and principles laid out in the Care Act. But it seems to me that there's been a little bit of a gap. Quite often, it's the manager and the staff who are working in the provided services who first become aware of a change in the needs of the person who they are supporting. This change might be that somebody needs an increase in support, or that somebody could do with a decrease in their support. Either way, the decision-making process is the same. But as I travel around the country delivering training, meeting people who provide services, it became very clear to me that those people are kind of out of the loop when it comes to how the Care Act decisions need to be made. So the course that 3Spirit and I want to run for you is Care Act Eligibility and Decision Making, specifically aimed at managers of care homes, of support services, anybody who's involved in delivering a provided service. The idea is not to equip you so that you can use the Care Act to argue more with the folk who commission you. The idea is to give you the same basis, the same grounding as I would if you were a social worker or a Care Act assessor, so that you can become the person who you support's best ally in making sure that the level of support that they receive is tailored to meet their needs. To do this, we'll spend a day exploring how the decisions are made in theory, and then we'll work through some practical examples. If you're interested in this course, please contact 3Spirit via the Facebook page. They're on Twitter, they've got a website, 3Spirit UK. Get in touch, pre-register, and we'll contact you as soon as we've got dates and venues sorted out. I look forward to meeting you. Bye-bye.